Good afternoon. As we prepare ourselves to hear from some of these great speakers, I ask that you silence all of your electronic instruments. And I do want to make you aware that we are providing child care services in room 303. And we're also doing vaccinations in room 302. So I just want to greet you on behalf of MD Wise. They are the major sponsor for this community baby shower. And I'd like to have Rachel come up. She is the community outreach supervisor and bring greetings to you.
Thank you, Ms. Jarnell. Hello, my name is Rachel Maxey. I am the Community Outreach Supervisor with MD Wise. I'd just like to thank you on behalf of myself, Minority Health Coalition of Marion County, and Indianapolis Healthy Start. Thank you so much for being here. The purpose of this baby shower is to make sure that you get as much information, resources that you need to, for yourself or for your family, and also, as Ms. Jarnell mentioned, we do have the vaccinations going on, so please, if you haven't been vaccinated yet and you're thinking about it, definitely you'll have that opportunity today to get your vaccinations done. But it's important for MD Wise to make sure that our moms and all moms in the community are able to have a healthy pregnancy, raise their child in a healthy environment, and make sure that we're being of service to you. So this baby shower is really just to make sure that you're able to get all the information and resources that you need. So definitely, if you have any questions, if you're an MD Wise member, or if you have any questions about insurance, please be sure to stop at MD Wise's table and seek Covering Kids and Families table to make sure that your insurance is good, or make sure you get your child enrolled in insurance as well. Thank you again for being here, and I hope you have a great time and enjoy the shower.
We're following all precautions. Whether you're expecting, planning, or already adapt to your new life with baby, this, our Healthy Start Community Shower, is an excellent place to get to know the local resources available. So please do visit your vendors. Our community showers are a little different from a typical baby shower. Our goal is to connect families with resources, other local families, community support, and moreover, to improve health outcomes for moms, infants, and all family members. But no worries, we also give gifts too. So we do have some nice gifts for you today. And as I mentioned, the prime sponsor of this community baby shower is MD Wise. The Marion County Public Health Department has been addressing infant mortality for over 2 decades. Tiffany Davis, MPH, MSN, RN, is the 3rd director for maternal and child health at the Marion County Public Health Department. Currently, she serves as an adjunct faculty at IUPUI in the Department of Epidemiology prior to becoming the MCH director in September of 2021. Tiffany was an infectious disease nurse epidemiologist. However, at the start of the COVID-19 pandemic, her role shifted, and she became one of the managers over the first COVID-19 vaccination clinic within Marion County. Tiffany is a boots on the ground worker and is known for her firsthand knowledge on how to serve. She's a member of Sigma Theta Tau International Honor Nursing Society, and holds several degrees. She has completed her BS of Science degree in psychology and sociology from Tennessee State University, earning her Master's of Public Health degree in epidemiology from Indiana University School of Medicine. She received her second BS degree in nursing from Marion University. And in May of 2021, she completed a Master's of Science degree in nursing, leadership, and management from Western Governors University. I say all of that to share with you the caliber of staff that the Marion County Public Health Department employs to ensure that they can improve the lives of the citizens of Marion County. Tiffany Davis.
Thank you. Thank you, Ms. Jarnell. Well, good afternoon, and giving honor to the house that we are in today, I am Mrs. Tiffany Davis, the new Director for Maternal and Child Health, and I thank you all so much for being here. Oh, next slide. Okay. So, Healthy Start programs started in 1991, and they are community-driven, located in the poorest neighborhoods in the United States. Healthy Start has several hundreds and thousands of families. Over 90% of Healthy Start families are African American, Hispanic, and Native Americans. Most Healthy Start projects have developed a consortium which comprised of neighborhood residents, clients, medical providers, social service agencies, faith representatives, business communities, all which fight to reduce infant mortality and low birth weight. Next slide. Indianapolis Healthy Start started 25 years ago. Ms. Jarnell Burks-Craig, the interim CEO for Minority Health Coalition of Marion County, helped write the first grants. Since then, IHS has worked diligently within the social and political climate to build strong partnerships to reduce perinatal health disparities, to improve low birth weights. Oh, thank you. And survivor rates in Marion County. Next slide. The 4 core elements for IHS are to improve women's health, improve family health, and also promote system change and build benchmarks, okay? Next slide. So the case management, what we do there is we have 101 support for pregnant women from birth up until the child is 18 months, home visitation to create care plans, assessment of child development and delays, stress management and depression screens, and interconception care. We have resources and involvement for fathers. Next slide. Our health education, we provide information to improve health of families before, during, and other pregnancies through referral classes and community connections. We have health education classes. We have 6 classes a month in 2 locations. We have safe sleep classes in English and Spanish, fatherhood classes, breastfeeding with Indiana Black Breastfeeding Coalition and with WIC. All classes are free and open to the public, and babe coupons are provided there. Next slide. So with our community connections is outreach, and the community health workers, they partner with the community. Our case managers are present in the WIC breastfeeding classes, which is prior to COVID-19. The case managers and community health workers, they attend OB registrations at St. Vincent Hospital, Eskenaski Hospital, and Eskenaski Federal Qualified Health Centers. Also schedule grassroots with community days with staff. We have quarterly meetings with staff, families, and community partners. Next slide. Okay. Our initiatives are monthly free health education classes, National Healthy Start Association. We have the CAN, which stands for Community Action Network, and Community Connections, and then also the FEMUR CAT-CAN. Our consultant is Dr. Jack Turman. We have the Indianapolis Healthy Babies Consortium with Lola, and also community partners. We have program referrals and marketing, and part of our grant is the maternal mortality severe initiative, where we try to focus on reducing maternal mortality. Next slide. And so we have our catchment areas with 11 zip codes, which are followed, and that's the map of our 11 zip codes that also shows the Eskenazi, FQHCs, and also with Barn Annex at the bottom. Next slide. So annually, IHS serves 400 pregnant women, 400 non-pregnant women and their families, approximately 300 deliveries amongst the program, and approximately 400 children between the ages of 0 to 18 months. Next slide. The demographics that we serve, over 60% are Black or African American, 10% is white, 30% is Hispanic. Next slide. For marital status, it's an even split. Some women are married and some are not. Next slide. Our quarterly report, that's an example of what they look like. Next slide. Just something to look at. And then the final slide, if you have some questions, you can contact Miss Victoria Ballard. She is the Community Engagement Coordinator for Indianapolis Healthy Start. Thank you.
Don't worry about the baby crying. We're accustomed to that, so don't feel ill at ease. It's okay. Our next speaker is Dr. Millicent Monier. Dr. Monier is known for her passion in making sure that everyone has access to health care. She believes that health care should be a right and not a privilege. She is also one of those well-educated persons that are employed at the Marion County Public Health Department, earning her bachelor's at Indiana University Bloomington, her medical degree from the University of Cincinnati College of Medicine, and did her residency at Indiana University Family Medicine residency. She belongs to the American Academy for Family Physicians, Indiana Academy of Family Physicians, American Board of Family Physicians, and presently serves as the president of the Asclepian Society here in Indianapolis, which is made up of all of the physicians here, African-American physicians here in the city. She is director of the Action Center, and she also serves patients for prenatal care, for prevention care. Dr. Monier.
Thank you, everyone. Oh, sorry. The good doctor forgot to spray, so forgive me. We do. Okay, I hope you can hear me over the mask. I have a mask on while I'm speaking. But I wanted to, again, welcome you all. There's a lot of information. Feel free to ask any questions that you may have. We are more than willing to help everyone. Thank you, Mrs. Craig, for that wonderful introduction. Like she said, I am very passionate about making sure that everyone has access to health care, especially in our underserved communities and our minority communities. That is and continues to be a problem. Access is something that we are working on. So I want to tell you guys about our program that we have within the Marion County Public Health Department. It is quite unique in that we have a special population that we serve. So let me first start and tell you where we're located. We're at 29th and Meridian Street, so 2868 North Pennsylvania. Next slide. A little bit about our history. You may wonder, the health department, we have a lot of different areas that we serve. What's unique about the Action Health Center? First, let me tell you what that stands for. It started out actually as an acronym, so it was an abbreviation. It stood for Adolescent Care Teams in Our Neighborhood. So what had happened was there had been studies done to actually see which populations specifically are most underserved. And it became apparent that those populations were the adolescent age groups. So it became one of the goals of the Marion County Public Health Department to better serve that population. And in doing so, we applied for a grant. So in 1988, we happened to have gotten that grant and started the Action Health Center, which is an extension of the adolescent health program within the health department. Since then, we have kind of changed from the population that we serve, and that we serve also pediatrics from birth all the way to young adults up to their 27th birthday. So that can include many parents as well as their children. Next slide. Our philosophy, just to go a little bit more on that. In addition to adolescent services, we also have general medicine care. So we have family medicine. As you may have heard in the introduction, I am a family medicine physician by training. So that means I am able to see persons from birth all the way until they stop breathing, so until death. We also offer gynecology as a part of this. So gynecologic services, that's another part that we like to expand on. Well woman, that includes well woman exams, so pap smears and such, as well as family planning, birth control counseling, all that. You'll hear some more information on the infant mortality rate and some of the areas that play into that. Family planning is an area that plays into infant mortality, among other items. We also offer social services, so we offer counseling. We have social workers that are on site that can both address counseling needs for mental health as well as social needs, housing needs, food needs. As you know, food insecurity is another area that plays into the delivering of quality health care. So as you see, the Action Health Center, we have multiple facets. Next slide, please. One of the things I wanted to kind of highlight when I was telling you about the Action Health Center is some of the accomplishments. So we don't serve our patients to get accolades, but sometimes that happens, and we do get congratulations on some of the things that we do. Some of those, in 2017, we received an award to congratulate our staff on getting great immunization rates in the area of human papillomavirus. So that, for some of you that are not aware of that, that is the virus that is responsible for genital warts, which leads to or can lead to cervical cancer. So that is why that is important. In 2011, we received an award from MD-Wise for providing excellent care for underserved. So MD-Wise is one of the sponsors here for the community baby shower. So that's one of the additional. Next slide. In 2006 and 2007, the Indiana State Board of Health also did give the Action Health Center a certificate of appreciation. And in 1990, there was an award from the National Medical Association. So again, that's the Association of African American Physicians here in the United States. Again, that recognized the excellence in adolescent care that was delivered. Next slide, please. In order to reach us, we want to increase accessibility. And in doing this, we are known to accept all types of insurance. Now, for those patients that do not have insurance, we are more than willing to see them. I can't state this enough, and that if a patient doesn't have the insurance, if they don't have the money, they have a medical need, we're going to see them. They may not have any other place to go, so that is really important. We do work to get them on insurance. I noticed amongst the vendors, there's Covering Kids. Well, Covering Kids has insurance navigators. So for those of you that may not have insurance, definitely take advantage of that, okay? When they get you signed up for the insurance so that you're not left out. We also offer Spanish languages. I myself, I've started learning a little bit of Spanish, un poquito, so I still need some assistance with that, but we have a full person there that is able to speak as a native speaker and deliver services. Next slide, please. So again, in closing, I want you guys to come and see us. We can definitely do a meet and greet. So you're not sure if our office is the right office? I think it is, but if you don't, come and make an appointment for a meet and greet. I see patients on most days of the week. We have a pediatrician that is full-time, and we have a nurse practitioner there also that is full-time. So definitely come in to see us. Our hours are Monday, Tuesday, Thursday, and Friday from 8 to 5, and Wednesday from 8 to 6. And then we also offer services on the second Saturday of every month, and that is from 9 to 1. In addition, I didn't put this on my slide, but because we are in the pandemic, we are also offering immunizations for COVID. That is given on Wednesdays from 3 to 5, and also on that second Saturday. We're doing those. So for those of you that have not been vaccinated, and we want everybody to get vaccinated, definitely get in touch and we can get you set up for that. You may also call our office at 317-221-3400. That information I have left in both Spanish as well as in English on the Minority Health Coalition, so please feel free to take those. Share them with your friends, and I hope to see everyone soon. I want everybody to stay healthy and get vaccinated. Thank you very much.
Before we hear from our last speaker in this segment of the program, I want to talk to you about the workshops. We're having a little problems with furnace today. So what we're going to do is we're going to combine the Safe Sleep Workshop and the Breastfeeding Workshop here in this room. We will have for the Men Parenting Workshop in room 404. Now I'm going to have her interpret those for those that speak Spanish.
Ok, los dos talleres que vamos a tener ahorita, el de
The Safe Sleep and the Breastfeeding is here.
ok, el de cómo amamentar y el otro de la seguridad de dormir va a ser en este cuarto.
And then the Men's Parenting Workshop.
Y el taller de los papás, ese va a ser en el cuarto 404.
Okay, thank you so much. All right. I know that this next speaker, if you haven't seen her on TV, you must not be watching. She is Indiana's Dr. Fauci. Yes. It is our own Dr. Virginia A. Kane. From Johns Hopkins to Indiana University. Dr. Virginia Kane is Director and Medical Officer of the Marion County Public Health Department. She is an Associate Professor of Medicine at Indiana University School of Medicine, Infectious Disease Division. She is an Indiana University Bicentennial Professor. She served as a president for American Public Health Association, the nation's largest and oldest public health organization. She received the by Crossroads 2017 August A. Wabinabe Life Science Champion of the Year, the first woman, the first African American. In 2020, the Indianapolis Business Journal, IBJ, named her as one of the 40th influential persons of the past 40 years, as they celebrated 40 years of progress in Indianapolis. Face and Places of IUPUI, 50 years in Indianapolis, named Dr. Virginia Kane as one of the 50 faces of IUPUI in 2020. I can go on to talk to you about a woman that has dedicated her life not only to the nation, but especially to the residents of Marion County. She has been the director of the Marion County Public Health Department for over 20 years and have led them through numerous pandemics, like she is leading us now through the COVID-19 pandemic. I bring to you Dr. Virginia A. Kane.
No, I'm not Dr. Fauci Jr. Okay, whatever. So, but hey, I'm so delighted to see everybody here this morning, despite the cold weather and everything. So it's just exciting to be here. And I just want to thank the sponsors for doing such a wonderful job and bringing what I think is a great program and resources here for everyone. What I thought, though, what I do today was just talk a little bit about what are some really good tips for having a healthy pregnancy and having a healthy baby, because I think that's just so important. And so when we look at the complications that sometimes we have with pregnant mothers, I think most of you know how important it is to eat healthy, eating the right foods and vegetables. But I'm not sure how many of you know how important special omega fatty acids are that we see in fish that helps make your heart strong and helps make your baby healthy. So I really want to encourage eating a little bit more fish, but you have to be concerned about fish that's high in mercury. So you only want to eat those fish that's low in mercury. So things like salmon is okay. I don't know if you've had a fish called tilapia, but tuna and shrimp are some fish that you can have. And so you may want to consider taking that and eating that twice a week. And so just so you know. And exercise is important, okay? You need to get that exercise. It'll later help you with your energy and prevent a lot of fatigue related to that. But if you want to start doing weightlifting or aerobics and you hadn't done that before your pregnancy, I want you to kind of lay off related to that. Don't start anything very strenuous at the start. And then the other thing is, it's so important to take your prenatal vitamins. You know, sometimes we're iron deficient before our pregnancy, and we might not have realized that. So it's so important that you're taking those vitamins every day. And then some of you, unfortunately, still have to do a lot of chores in your house. And so I want you, if you can, to avoid using any cleansers that have a lot of toxic chemicals in it, if you can avoid doing anything related to that. And then secondly, I know how important it is to have comfortable shoes, because I hate to say it, you may gain a little weight here during this pregnancy, okay? All right? And so the better your shoes are more comfortable because you're adding more weight, it's going to be really helpful for you. And if you can, our goal is that you gain no more than 25 to 35 pounds during your pregnancy. Now, you may gain some more because, you know, if you're pregnant, it does cause more fluid plasma to come through your body, but that's a lot of weight that once you have your baby, that you have to try to get back down to your pre-pregnancy rate. So just to think about that. And, a lot of you, it's unfortunate, we experience some morning sickness, nausea related to your pregnancy. And so it is so much better if you can eat multiple small meals through the day. Even having some snacks during the day, which can help that nausea significantly. And we need you to eat your vegetables, okay? That's so important. And limit your caffeine if possible. And alcohol is a no-no. Alcohol is a no-no. But even smoking is a no-no for your pregnancy of your body. That nicotine can go in there and cause a lot of complications for your baby. Here's the hard part, though. Secondhand smoke. Secondhand smoke that if you've already delivered your baby can cause a baby to die. So you can't even have anyone smoking inside your apartment or your house or wherever you're staying. If you have smokers, you ask them to smoke outside because it can cause what we call sudden infant death syndromes, where your baby will just die from an unexplained reason, but we do know it's related to the smoking. So always remember that. And then you got to get plenty of sleep. And you have to make sure that you're brushing your teeth regularly. There's some bacteria sometimes in your teeth that can sometimes cause an infection in your body. And so it's so important in order for you to do that. And then, try to think about stretching before you go to bed. You need plenty of sleep. But if you do more stretching before you go to bed, it helps to relieve those cramps that sometimes you can get related to your pregnancy. Now, let me just say, do you guys know what the tips are that you have to worry about? What are those things that you're supposed to call your doctor about during your pregnancy? So, if for some reason you start experiencing some bleeding, okay, or you're starting to experience some cramping, significant cramping, or you're starting to have a significant leaking of fluids during your pregnancy, you need to call your doctor. Now you say, oh, I can't call my doctor about this. That is why doctors carry around pagers. They want you to call them when you have a concern so they can make sure that there's nothing serious going on that they need to check you out. So why do doctors have pagers? So that you have the ability to contact them if you should all of a sudden see some spotting or bleeding, you're having significant cramping that you hadn't had before, or leaking of fluids coming from you. And especially if you have some leaking of fluids that's sort of foul smelling, or it looks more like pus instead of clear fluid. So make sure that you're talking to your doctor. Now, you're going to have an increased vaginal discharge as you get later in your pregnancy, okay? That's going to happen, but we want it to be sort of clear looking at that because we need you to keep your prenatal visits. And let me tell you why you should keep your visits. They check your blood pressure. They need to make sure you're not developing this complication called preeclampsia, where your blood pressure gets so high, you can have a stroke, you can develop seizures, and it can also cause some undue negative complications to your baby. So they check your blood pressures when you come in, and they check your urine. They check your urine for proteins. And if you have a significant amount of proteins in there, that can create your blood pressure going up skyrocketed. And especially if all of a sudden you're having lots of headaches, and boy, I'm having significant headaches, and it's not going away. So you're having a headache. Well, I got a headache today, and the next day I still got a headache, it's not going away, you immediately get yourself checked out to make sure that your blood pressure is not sky high. So headaches, my vision may be blurred. I can't see. Something is not, it looks like I need some new glasses because all of a sudden I can't see as clearly like I should be seeing. If that happens during your pregnancy, that is not something you can wait weeks until you are at your appointment day. That's something that really needs to be checked out in 24, 48 hours. But definitely talk to your doctor about that. Now, I see some men here in the room. So let me just say, hey, by the time you're 34 weeks pregnant, you're tired of this baby, okay? You're tired. You know, you're ready for this situation to be over. So folks, sisters, relatives, fathers of the baby, you tell mom she's looking great, even though she may be suspect, okay? Tell her that makeup is fabulous, honey. I've never seen you look so more beautiful than I've ever seen you before. Start doing that. You can do it before, but after 30 weeks, 34 weeks, it's really important for you to be telling the mother of the child how important it is. Lastly, let me just say, you know, our men, fathers of the baby, they play an important role. And you know, men are good about fixing stuff. They can fix that car, mechanic, or other things like that. But for them, it may be very difficult to fix any issues related to your pregnancy. So that can sometimes make them, kind of scared. And sometimes they may be a little hostile or angry, but it's because they feel they should be able to be doing something and they don't always have the ability to do it compared to the other aspects of your life. So it's just not about you. These are about their dads feeling that they should be able to do more. But they can once the baby. We don't want you to do any heavy lifting, okay? Heavy lifting is out. And listen, once you have that baby, you're going to be tired. There's going to be sleep deprivation. Because every 2 hours, you got to be feeding that baby once you have that baby. So a lot of fatigue and deprivation. So it's just so important that, one, think about breastfeeding. Breastfeeding contains mother's maternal antibodies. This helps you fight respiratory infections, help you fight ear infections, okay? And it can even prevent your baby's getting asthma if you breastfeed your baby. And it also prevents them from getting obese later in life, way overweight later in life. But you need those maternal antibodies because of this pandemic, especially that's going on. But there are a lot of infections out there for babies that can cause your babies to be hospitalized, okay? Very, very sick. So if you can, it's so critical, try to do breastfeeding, at least, if you can't do it, at least 3 months to get it started, but preferably at least 6 months if you're able to breastfeed. Make sure that you do that. And let me just say, I look forward to seeing some of these gorgeous babies that you're going, precious babies. And look at that precious baby down there at the front. Okay, and they're just so beautiful. And they're so wonderful. Take good care of them. And by that, if you can, if some of you are still pregnant, make sure you already have identified a pediatrician or a family doctor or a nurse practitioner that's going to be able to take care of your baby after your baby is born. So you can be thinking about that, looking about that now. And it's critical that your babies get the necessary immunizations, the shots that they need to protect them from other items. But ladies, we want you to be beautiful, comfortable. So buy those beautiful essential oil scents. Take that bath and take care of yourself. I want you to treat yourself well, okay? You take care of yourself. If you're taking care of yourself, that means you're doing a great job of taking care of your baby. So fathers, mothers of your babies, may this be your best blessing that you will ever receive. And you know how precious having a child is. Nothing replaces having the blessings of having a young baby come into your life. Nothing will ever replace that. And just know how blessed all of you are to be here this day, having a healthy pregnancy and learning, always learn, educate yourself about what you need to know in order to have a healthy mother and a healthy baby. And so also asked about whether, with your healthcare providers, whether moms, should you be taking an aspirin every day, a low dose aspirin. Sometimes people can be at risk for high blood pressure or diabetes, during this pregnancy. So asked about, should you be taking a low dose aspirin during your pregnancy to help prevent some of that. But good luck. If I ever see you on the street or in some other event, I want to see some pictures of your baby now. So, not about you. I just want to see the pictures of the baby. Okay? Have a beautiful day today. Thank you. And thanks again for our sponsors.
Can you have the interpreter come back? Thank you so much. That ends the portion of our speakers. We are now going to pause for just a moment. I'm going to have the interpreter to come back, and we're going to designate where we're wanting you to go. As we indicated, the breastfeeding and the safe sleep will be held here in the sanctuary, and we will then have the men go into the men parenting class. And once that is done, we will then give out our token for your coming. We have gift cards, and we have gift cards to give to the mothers as well as a food voucher for Chick-fil-A. The men will be getting their gas cards in the workshops.
Walmart card.
Oh, I'm sorry, Walmart cards is for the men, and it will be passed out in their workshops.
And then the food boxes.
And we also have food boxes that we will be giving to each of you as you leave. Let us thank Met. Come. She has done a wonderful job in pulling this together. Little Ray, when I first met her, I kept thinking, whose daughter is that? But Rachel has done a great job. She is the outreach supervisor for MDYs, and I want you all to thank her for all the hard work that she has put forth in making sure that we improve the status of infant mortality in Marion County. I also want to thank Tiffany Davis, who is Director of Maternal and Child Healthy. The Indianapolis Healthy Start played a major role in sponsoring this event today. They will be giving away the pack and plays that you will be receiving once you leave. Each one of the parents, each one of the pregnant moms will be receiving also a pack and play. Dr. Monet, as she explains to you all of the services that are available to you at the Action Center. Cannot do any of this.
Do they know what a pack and play is?
A pack and play is a little crib that you can use for your baby up to 2 years. I think you can use this crib up to 2 years to have your baby sleep in. It's a wonderful item, as Dr. Kane indicated on the radio yesterday. It's well over $100, but it is something that I think that you would cherish, and it will help you keep an eye on your child as they grow up. So all of this, as I said to you before, I want to thank David. I don't see David Brown. Oh, there's David Brown. This is his church. He opened his church up to us, and he is currently the president of the Minority Health Coalition of Marion County, and the staff of the Minority Health Coalition of Marion County and Indianapolis Healthy Start has also played a big role in making sure this happens for you today, and I want to appreciate them for that. And I cannot always not thank the person that has helped the Minority Health Coalition continue to exist. And we are celebrating our 35th anniversary this year is Dr. Virginia Kane, who continues to fund our non-for-profit organization in helping us to get out into the community to provide you with the necessary information in hopes that you will be able to celebrate your baby's first birthday. Thank you all for coming, and then we're now going to split into the workshops.